Over the past few months, we've had many depressing charts, and I'm afraid that I've got some more depressing ones, but these are really important because we're trying to get a sense now of the historical perspective of where we are with COVID-19. A lot of people saying, how does this really compare with other epidemics that we've had so far this century? Was it worse than the ones that we've had in the past 50 years? Well, now we finally have the data that might well be able to prove whether the answer is yes or no definitively. And I'm going to show you that data. It's just simply numbers of people who have died in England and Wales for this year compared with the previous years. And what we're able to do is look back all the way towards the 1840s. There's lots of data on this, as you'd imagine. And what that means we can do is we can compare where we are at the moment with previous episodes where you had high mortality. So, for instance, the potato blight of the 1840s, potato famine, of course, in Ireland, but it affected much of Europe as well, including parts of England as well. The Great Freeze of 1895, very cold winter there, caused very high levels of death too. You've got World War I and World War II, obviously, high levels of mortality. We're talking about civilian mortality, I should say here, rather than military deaths. But nonetheless, you've got higher levels of mortality in those areas, in those periods as well. And then you've got the post-war epidemics. So influenza epidemic in 1951, very high levels of deaths there. Hong Kong flu of 1968, 1969. You might remember when we were looking at excess deaths, this kind of measure of total deaths across the population, back in the height of summer when we were starting to get those horrible numbers through, we were kind of wondering whether it was as bad as Hong Kong flu or indeed worse. And actually some weeks of Hong Kong flu had slightly higher levels of mortality. So now we finally have the annual numbers through. We're able to make a comparison as to whether this is more severe or less severe than that. And here's what the numbers show. So here is COVID-19. I'm going to add the line on to show you the increase in 2020. And what I'm actually going to do is just kind of change the axis scale. So the same data, precisely the same data, but we're going to kind of zoom in. So we'll just get rid of the bottom 350,000 so you can see it more in perspective. And what you see there is look at that line, and we're going to draw a line between there going all the way back as far as possible. And you can see we're over 600,000 deaths in 2020. The last time we had more than 600,000 deaths was 1918, so the year of the Spanish influenza, the final year of World War I. Really gives you a sense of what we're talking about here. But probably you've noticed there is an issue with this data. It's not population adjusted. And over this period, the population in England and Wales and indeed the UK has risen. So really, we do need to adjust for population. And if we do, it's a somewhat different picture. So same thing again, same kind of time, same different episodes of mortality. And what I've done instead is we've taken deaths per 1,000 of the population. So we've got the population adjustment here. And you can see a clear trend, can't you? It's coming down. People are living longer. You've got improvements, medical improvements, which mean that fewer people are dying as a percentage of the population until we get to here. So COVID-19, let's just look at what happened in 2020. Again, so 2020 data just through shows that. And it's not as big an increase as you saw in that other chart, is it? In fact, we're talking about 10 per 1,000. The last time we were at that kind of level was 2003. Doesn't sound like all that long ago, does it? So it's worth bearing that in mind. But here's the thing. It's the change in direction that really matters here. If you're really making a good comparison here to see how this year, or indeed last year, compares with the years around it, you need to do an excess death comparison. So you're taking the particular year you're in at the moment, comparing it with the death level you had in previous years. And that's what I've done here. This is population-adjusted excess deaths and just how much those deaths are changing compared with the previous 5-year average. Again, the same thing. We can compare where we are now with previous episodes where you had high levels of mortality. And here's what this data shows you. So you can see for most of history, it's not going that far from that zero line. And the zero line basically suggests things staying the same as they were in the previous year when you adjust for population. You had high levels of mortality, and then you had kind of low levels of mortality when you're going back to the kind of Victorian period there. But around this period, for the most part, it was fewer deaths until we got to 2020. I'm going to add on the line for what happened in 2020, and you can see a very big increase here in excess deaths. We're looking at historical excess deaths in England and Wales compared with going all the way back to 1840. And if we draw a line here, the last time excess deaths were as high, and this is population adjusted, were as high as they were last year in 2020. The last time we had a 12% increase in deaths or anything close to it was 1940, so the middle of World War II. You had that period where you had very high levels of civilian deaths. It's worse than any of these post-war pandemics, worse than Hong Kong flu, worse than 1951 flu, worse than the Asian flu, which was also in the 1950s. It is a very severe increase in excess deaths. But again, this isn't really the gold standard of measuring these things. If you really want the gold standard, you need to look at what's called age-standardized mortality, which adjusts it by population, but also by age levels throughout the population. And here's what you get if you look at that. Now, it's slightly different this time. Anything above the line is kind of good news, that's improving mortality. Anything below the line is deteriorating mortality. And again, the same kind of picture. These are bars. So for each year, you're showing whether you're getting better mortality or worse mortality. And for the most part, for most of the 20th century, most of these bars are kind of above the line. People are living longer, they're doing better. But just look at what happens in 2020. You can see the bar goes all the way down. What we're looking at here are annual changes in mortality, age-adjusted mortality, as produced by the Institute and Faculty of Actuaries. And again, same exercise. Let's draw that line back into history and work out the last time we had a 13% annual fall in mortality or anything like it. Well, not since 1929. 1929, there was a flu epidemic, a pandemic, and at the same time, you had obviously the Wall Street crash and you had an economic toll as well. So we are talking about, pretty much however you look at the numbers in most of these comparable mortality calculations, this is the worst in many, many years. And we're only, a fraction of the way through this pandemic. More people still dying at the moment. It's deeply depressing. If we just compare those periods, so again, it's that same chart, but what I've done is just picked out the years where you had the biggest annual mortality falls in England and Wales. Well, here is where 2020 ranks. I'll just kind of highlight it there. There's COVID-19. So these are the biggest of all in terms of years where mortality deteriorated. 1895, the Great Freeze, very high levels of mortality there. 1929, I just mentioned a moment ago, flu and depression. Then there comes COVID-19. Then you've got 1847, famous cholera outbreaks. Then 1915 and then 1940, so during World War I and during World War II. It's worth saying, there are various different ways of measuring this, and due to the fact that this is just annual changes, the Spanish influenza doesn't really show up here as much because it came in, after World War I when there were high levels of mortality anywhere. There isn't one single definitive way of measuring this stuff, but pretty much whatever you look at, this is bad. It's very bad in comparison with pretty much any period you're looking at here. And I think that's the striking thing. This comes before you consider the number of people whose lives might have been saved by all the lockdowns. It comes before you consider the fact that we still have more people potentially yet to die of this disease. It just goes to show this really has been a historic pandemic.